Hi guys, I'm Nicolette, and today Brian and I are here with Seth Denson. He is the co-founder and chief strategist at GDP Advisors and also author of The Cure. Seth, thank you so much for coming and joining us today to talk a little bit about what's going on. Can't deny what's going on in the world. Can you tell the audience just a little bit about yourself?
I've spent the better part of my vocational career in the healthcare sector, primarily on the patient advocacy and financial management side of things. So I by no means am a doctor. Don't tell my grandmother that. I think she's still convinced that I am. But I actually make sure doctors get paid for what they do and people get treated for what they need from a financial perspective. So we manage those. We manage financial assets for corporations to manage better care for their employees. That's our primary clients.
So Seth, we're in the middle of a global health crisis. Yeah. So you've been talking a lot about this on the media, and we want to know, what do we need to know right now? What do we know that we need to know?
Yeah, I think that if I am going to share one message, and we can obviously share multiples today, but if there was one thing I would want to tell people is just encourage them and say, we're going to get through this. We absolutely right here in the United States have the most brilliant medical minds in the world. We have the most innovative and effective healthcare system throughout the world right here. And we're going to get through this. We've gotten through a lot of really bad things over the years. Matter of fact, if you look statistically, since 1980, we've had 12 healthcare, we'll call them pandemics in the world. And for the vast majority of those, within, I think 11 of the 12, within 6 to 8 months, they were almost non-existent. And so I think that if we utilize history, and I was a history major in college as a predicator for the future, I think that I would say that we're going to get through this. And that's something that people need to remember. The other thing I would say to that, though, is getting through this is all of our responsibilities. This is something we all need to band together, and there's no more important time for us to put politics aside and say, hey, we're humanity first. It's one thing to say that we're Americans first in this, but we're humanity first. This is a global problem, and we need to come together and work together and support one another to get past it.
So I think that's really important, though, for people to hear right now, because I'm sure you've noticed there's some mass hysteria and panic, and
just a little bit.
So to draw on that history, I think is really important for people to just take that into consideration and acknowledge that, because we're not hearing a lot about that. Have you noticed that we're not hearing a lot about the positive?
Yeah, and unfortunately, I think that's partly the sign of the times. Negativity sells. I hate to say it that way, but it does. And that's just an era of the world that we live in. But in another side, and I want to say this too, sometimes the negative aspect can be a motivator. And so if you are trying to get people to stay home and do social distancing, you scare them into it. That's just quite frankly the way we do it. But when you combine that with the fact that pretty much 24/7 people are glued to their TVs right now, and glued to outlets that provide information. And by the way, they're not free outlets. And I think that that's something important for us all to remember, and recognize that unfortunately in crisis, there's opportunity, and not always all of that opportunity is a good thing.
Right. So, one of the questions I have, and look, before even we started locking down, right, we talked about sort of isolation, things were going on. People were going from different countries to, America and vice versa, and traveling, right? One of the things in my mind, all of us were sick this flu season, and a lot of us didn't have the flu, right?
Right.
Is it, the theory is, did some of us have this? Did it start infecting and we just didn't realize what it was,
Yeah, I think that's part of what we don't really know right now. This is one of those things that, quite frankly, there could have been people walking around with this because it can be asymptomatic.
Right.
There's, people may be walking around right now that we just don't know. And that's part of I think what we'll call the fear side of this. And again, I mentioned earlier, I talk to doctors all the time, and they're telling me right now, Seth, the biggest thing with this isn't the fact that we aren't convinced we'll get a vaccine or convinced that we will find ways to eradicate this from the world. Our fear is that we just don't know what that's going to take, how many mutations of this there are, how many people are walking around with it, quite frankly, that we just don't know about. And so I think it is a fair estimate or assumption to make that, yeah, this has probably been lingering around longer than the last, we'll call it month or a few weeks specifically, that we're starting to see it ramp up.
So Seth, recently I was reading one of your posts on LinkedIn about drug manufacturing in moving to the US, and there was a bit of a positive tone there, when we talk about that. What are your thoughts on the impact this could have long term on drug manufacturing?
Yeah, I think through crises, we find alarm bells that go off and say, hey, these are things that we need to start paying attention to and start planning for, right? And sadly, and I'm glad you found optimism in it, because I like to always find optimism in everything, but this is a very non-optimistic situation that we find ourselves in that roughly 97% by some estimates of our antibiotics come from China. And that 90% of the APIs, these are effectively the ingredients that go into the vast majority of the drugs that are generated, are also coming from China and foreign markets. And so for the United States, who, by the way, is the innovator of medicines, vast majority of them, to be offshoring the ingredients of these drugs puts us in a very precarious position to bring those back on shore quickly. And I think that's partly what we are potentially experiencing now. We can do it, but we need to start planning for it. Now, my fear is that if we had another pandemic arise in the coming days, weeks, months, or even a year, we may not be well prepared for it, because quite frankly, we just can't manufacture internally the drugs here in the United States. And so this is a wake-up call for those of us that have been sounding that alarm for years, by the way, that hey, now let's let some people listen to this. We need to bring that back on shore so that we can become drug independent. We talk about energy independence all the time. How about medicine independence? Right? We need to bring that back on shore, and we need to get that ramped up quickly.
Yeah. Do you think with the bringing the manufacturing of, drugs and things like that back, domestically, we'll also see that in sort of like medical electronics, like we see now, like respirators, there's no respirators, and people are actually now 3D printing parts for them, because we could manufacture those, Do you think we're going to see more manufacturing of, medical electronics or even electronics back in the US also?
Yeah, I think so. I think all of these things are going to bring more people to an awareness that we need to bring things back on shore in some capacities. I mean, listen, let's be real. And again, from an economics perspective, there is a balance there. We have a really expensive healthcare system, and we need to find ways to bring down the cost of that healthcare system, and bringing everything back on shore is not the answer to that for everything. But I think, listen, there's moderation, there's balance in everything. Right. And to the credit of some of those manufacturers that are here in the United States that make things like ventilators, they're ramping up. And guess what? They're going to have a very good fiscal year this year as a result. And that's the beauty of our free market capitalistic system. And I think that, listen, there's a lot of debate going on about whether healthcare should be a part of a free market capitalistic system. I lean on the side of absolutely, because I think that's where innovation comes from and ingenuity. I think that we can have deeper conversations about healthcare being accessible and lower in cost, and that's a lot longer than we'll probably cover on today's topic. But I wrote a whole book about it, though. But that's the thing that we need to have deeper conversations about. So to your point, Ryan, yes, I think that this will bring things back on shore. You will also find, and this is what I'm really encouraged about. Listen, we defeated Nazism in World War II because of American manufacturing. Because American manufacturing stepped up and said, we're going to do more than our enemies are going to do. And 2/3 of all of the materials needed to defeat Nazism in World War II came from factories right here in the United States. Places like, Henry Ford's factory that started making components, and all these others, Pitney Bowes, who made postage meters, started making bomb parts, right? And so this is the beauty of American ingenuity and togetherness. And we're seeing that playing out right now. And that's what I'm really encouraged by.
That's a really positive message for everyone to hear out there. I mean, I think it's great. It's where we need to go as a country.
Right. And that's part of. Go ahead.
I was just saying, it's easy for us sometimes to demonize, so to speak, corporate America, especially when we're seeing, stock prices doing what they're doing. We're seeing things like, I've heard it a number of times the last few weeks, airlines wanting a bailout now. Well, they spent the past 4 years doing stock buybacks. And so it is easy to latch onto those things. But listen, I always say the cream rises to the top. And you're really starting to see that a lot of these companies are saying, hey, we're about humanity and our people first.
Right.
And in this moment, we're going to do what we need to do. And that's encouraging.
That's right. And to Brian's point, people really need to hear that right now. I mean, I'm flooded. And that's part of why we asked you to come on, to kind of give us some information, because we're not sure. I don't think the American public is sure what they're getting, and if is it real, is it not real? But to your point, we don't know a lot, and I think it's important to say that, to say that, and not, unfortunately, it does cause some fear, but to state those facts. I had a question actually when we were talking about manufacturing. Brian and I were talking about the tests. Are those, you had mentioned, Brian, those are manufactured outside of the U.S. as well? Are you seeing
we were talking about some test kits are manufactured outside the U.S., right? Now, obviously, the ones that are being done now, like we saw, and I can't think of his name, the president of Alibaba was offering some test kits into the U.S., right? Do we do a lot of manufacturing of test kits for this? Are we manufacturing these, or are these being done outside of our country?
Well, I think there's a little bit of both. I mean, that's just the reality of it. The key for testing is you have to have the understanding of what you're trying to accomplish through the test for the test to be manufactured correctly. And I think that was the challenge with the coronavirus. And listen, it's easy for a lot of us to Monday morning quarterback this thing, and that's a place of comfort sometimes. But no question, CDC dropped the ball on this. Let's just be real and let's call it what it is. This thing has been around for a little bit, and we should have been more prepared for the testing and that being ramping up. But yes, so companies like LabCorp and Quest Diagnostics and some of these other companies, they'll utilize manufacturing and components both here onshore and offshore through quality testing, quality assurance purposes. These things will be fine. But again, they have to have the component capability of understanding what they're trying to derive from the test. Expect that to ramp up very quickly. Again, these two companies specifically and other private labs have gotten the all clear from the FDA now to start mass producing and mass testing. And so this will be a positive. Although I will tell your listeners, don't be a hypochondriac testing wannabe, right? The reality is that as of right now, we're actually still in flu season. And we're moving from flu season to allergy season. And I don't know about where you guys are, but in Texas, we have what's called ragweed. And that ain't the good kind, right? That's the stuff that, kind of really makes you. But I by every year around this time, I'm going to get an upper respiratory sinus infection. And that's just the way life is for me.
Yep. Same here. I get allergies too. So I know exactly what you're talking about. Yep.
So don't misconstrue that. And I would tell that, your viewers, listen, recognize that our healthcare system is taxed right now. It's taxed in two ways, and I want to be clear about this. Yes, we are seeing more and more cases of this pop up. It's nowhere near where it could be, but it's nowhere near where I think some of the fear mongers are saying that it is. But the other thing is, we still have everyday healthcare issues going on.
Yes.
So it's not just because we have this that everything else has stopped. Strokes are still happening, heart attacks are still happening, cancer treatments are still happening. The healthcare system is already still churning out what it needs to be churning out. And so, don't add an extra burden to that, right? This is the truth. Right now, there is zero, nada, nothing treatment-wise for coronavirus.
Right.
There it is, right? So if you are, and the vast majority of people are either going to be asymptomatic or B, have cold flu-like symptoms. So listen, use common sense and use what you normally would do. Stay home, chicken soup, Netflix, Hulu, whatever you subscribe to. Y'all subscribe to the YouTube channel, right? Stay in tune, right? Wash your hands. Don't infect other people. Do what you would normally do. If you have questions, call.
Yes.
Don't show up.
Yes.
And don't become an added burden to this. Don't be part of the problem.
I will tell a quick personal story. I called my primary physician yesterday because, like you mentioned, those allergies, and every year I get, I can't breathe. I just can't breathe. So I called him and I said, look, I don't have the coronavirus. I'm just telling you right now. I said, but am I getting a sinus infection? I might need antibiotics. I don't want to come in. And he says, take your asthma pump. He said, no, you don't have the coronavirus, but here's the thing. You're probably going to get it. Just stay home and rest and you'll be all right.
Right.
Basically, don't bother me.
Yeah. Listen, I got a note from my doctor this week he sent out a note to all of his patients and effectively said, stop coming in where, you know what, I can't help you anyway, right? If you really think you have this, call us. We'll talk through it. We'll try to diagnose it. And if necessary, we'll send you for testing. And, you know, but, you know, listen, do your part. Listen, and I'll say this, let's, you know, kind of shifting from that. Let's stop with the toilet paper panic. I don't understand this. You know, we actually don't have a supply chain problem in the United States. We have a demand causing temporary panic problem. And listen, I was in the store just this past weekend and quite frankly, wasn't going for toilet paper. I was going for milk, and you know, then they rolled out a crate, and it was like a scene from The Walking Dead. And you know, what's sad was you see people who probably actually just need a roll of toilet paper. They can't get it. So don't be that person, right? You know, let's all be good Americans and share with one another. I you know, we talked about what the industry is doing and, you know, corporations are doing. I'm loving to see what the grocery stores are doing about opening up early for elderly people. I mean, just where I live in Dallas, we're hearing story upon story of, you know, of these organizations that are coming together and saying, hey, if you have someone who's elderly, has an underlying health condition, go do their grocery shopping for them, right? This is America at our best. And I am so encouraged by that. And, you know, I think from that perspective, I don't know that it could have happened at a better time. I think we needed, I'm not saying we needed this. Let's be very careful. It's awesome to have those moments when we do come together, though, and say, man, we can be greater than just about anything when we align ourselves. And I am so encouraged by that. So be part of that. That's a powerful thing.
Absolutely.
That's a great message, Seth.
It is.
Brian, I know you wanted to ask one thing before we close up. I know you had to the toilet paper comment.
So yeah, I mean, the thing I didn't get is you saw a panic buying of guns and ammunition, which was a little scary. And I know that's not in your wheelhouse. That's, you know, you're you know,
well, I'm a Texan, so
I know, that's why I asked. I mean, you know, so it was, you know, I drove by some local gun stores, and I was driving by, same thing. I was going to get some milk, and I was like, it was like the whole parking lot was full. I've never seen it that way. You know, there were people outside.
Yeah. You know, I think that you see this anytime there's some type of massive issue. I mean, obviously we saw it after 9/11. You see it in critical times. And I think that unfortunately, this kind of goes into that panic fear mentality of people. I think today more than ever are stuck in their echo chambers. And they're not willing to get out of them. And if you're in the wrong echo chamber when bad things happen, you're probably going to make some decisions that aren't necessary. But you're driven to do that because you're not willing to kind of step out of maybe your silo and be realistic. And I think that's probably causing some of this. And listen, there's people just like those that are panicking saying, well, I might have this. There's those same people who say, well, what happens if toilet paper and food are gone and I get looted? I need to protect my family. And so there's multiple sides to this. But I think if we all would step back, listen to all parties. I would say, listen to doctors more than politicians. Let's just be clear on that. Let's not get all of our information.
Absolutely.
Let's not get all of our information from Twitter, right? And let's just bring some common sense into the conversation and some realism and some togetherness. And I think we'll be fine.
Thank you so much, Seth. Thank you for joining us. Thank you for that positive message. We really, really appreciate your time. And thank you for being a part of this.
Yeah, absolutely. Well, thank you for delivering the message. And, you know, hey, listen, we all have opportunity right now to go spend time with our kids and our families that we've all been saying we want. Let's take advantage of it, right?
Thank you. Thank you so much. And where can we get your book? Tell us about your book.
That's what I was about to say.
Oh, hey, yeah, thank you. So there's anywhere you get your books, where books are sold, although I heard that Target sold out of it, which is a good thing. But Amazon, they'll deliver it to your door. You don't have to go out to get it. Or you can go to our website, or my website, which is SethDenson.com. And you can subscribe to our pages too. That'd be great. All of our stuff. We're putting updates out there regularly on this as well. And so please, we'd love for your subscribers to become our subscribers and our subscribers to become your subscribers. And so, but yeah, thanks to you. But yeah, Amazon, anywhere you get your book, our website as well.
Awesome.
Thank you,
so
Seth. Have a great day.
Thank you. So y'all too. Keep up the good work.
You too.